Welcome to the Harvard Health Minute. I'm Dr. Terry Schrader. We hear a lot about depression in women, but what about depression in men? Men certainly have mental health issues and certainly get depression, but they are less likely to recognize the symptoms initially and less likely to seek treatment. And if the depression is severe and left untreated, they are actually more likely to commit suicide. To talk to us more about depression in men is Dr. Michael Miller, Assistant Professor of Psychiatry at Harvard Medical School.
That's right.
Welcome, Dr. Miller.
Thank you for having me.
How do the symptoms differ in men versus women when it comes to depression?
Many of the symptoms are the same. The loss of sleep, low energy, difficulty feeling motivated, feeling sad, feeling blue. But in men, first of all, they tend not to talk about those symptoms so much, and they're more likely to appear irritable, cranky, demoralized, and not lead with sadness.
So they might have angry outbursts, they might be losing their temper, but they're toughing it out. They're not recognizing that something is wrong.
That's exactly right. Men tend to want to be seen as strong. They tend to not want to talk to people about their feelings, about their problems. Women are much more comfortable doing that, and they're more likely, as a result, to get help.
But men are particularly vulnerable to ignoring the symptoms, not recognizing them. Why is that?
You know, I'm not sure why. It's a huge question, and in centuries we probably won't get the answer. But it's social in part. It's part of the culture for men to tough it out. There may be a biological difference. Testosterone may lead men to be more irritable than sad. This is something that's we've seen for centuries. Fortunately, our culture has changed a little bit, so there's more encouragement to get help. So it's better than 50 years ago, probably my parents' and grandparents' generation, but it's still tough for men to get help.
So what types of treatment are available?
The main treatments for depression are psychotherapy and medication. There are some other things you can do also. Psychotherapy is helpful. Just going and talking to somebody and getting outside your head can be very helpful, even once or twice. Having somebody sympathetic, encouraging, somebody who can give you perspective on your problems and maybe some advice about how to manage your feelings better. And medication, there are many men who take medicines, and you might not know about it, but even a lowish dose of an antidepressant can help take the edge off of that demoralized, burdened feeling and help somebody manage their life better. Things like exercise, diet are also helpful. These kinds of lifestyle things that tend to be good for your heart are also good for your brain and good for your mood.
So if a man is worried that something's wrong and that he may have depression, how does he go about finding a therapist?
Well, the first step, I think, is to go to your primary care doctor. If you're employed, to go to the employee assistance program. They may have somebody who you can talk to. Friends may have ideas. Again, a man may be surprised how many of his friends, his male friends, have had these problems and are getting help for them, and they may have ideas about who to see. And also, if you are in a religious community and you trust your rabbi or your priest or minister, that this is somebody you could also ask.
So the bottom line is to seek help, because depression is treatable, but it needs to be recognized, and the person really has to go to the right person to find the help.
Yes, the bottom line is treatment helps, and talk to somebody about your problems and let them know that you're having a tough time, and that will lead to a better chance of help.
And see if it is in fact depression.
Correct.
Important information. Thank you very much, Dr. Miller.
You're welcome.